Once again, welcome back to obstetrics and gynecology videos. Today we are going to see how to take care of a woman during her pregnancy for getting a healthy baby, and in order to preserve or in order to maintain the health status of the woman, we are supposed to take care of the mothers during pregnancy period. Let us see the definition of antenatal care. It's a systemic supervision of a woman during pregnancy. That is known as antenatal care. Otherwise, antenatal care refers to the care given to an expectant mother from the time of conception until the beginning of labor. That is, it is a care we are giving to the woman from the time of conception, that is from the time of fertilization till the onset of labor. Now let us see the aims of antenatal care. It helps for screening the high risk cases in case if the mother is having certain risk. For example, if it is a consanguineous marriage means marriage between the close relatives, blood relatives. Otherwise, if the mother is having heart diseases, or if the mother is having severe diabetes mellitus, or if the mother is a known case of hypertension, if the mother is having HIV, these cases are few examples for the high risk cases. So, for identifying such risk cases. And another one, prevent the complications, or in order to detect the complications earlier and in order to treat the complications earlier. That is the second aim. And third one, in order to ensure the continuous medical surveillance and prophylaxis. Throughout the pregnancy, we are supposed to give medical support to the woman, and for that also it is helping. And in order to educate the mother about the physiology of pregnancy, labor, by using the charts, demonstrations, diagrams, so the fear is removed and psychology is improved. See, usually once if a lady is pregnant, she may not be knowing what are the signs of onset of labor, or during the labor process, when the labor process is getting started, what are the symptoms she will be feeling, or what are the signs she will be she can see. So she may not be having any idea. So repeatedly she may think that okay, the labor process was started, and she may go to the hospital again, she will come back. Such scenarios we can avoid if the mother is well educated. And another one, she needs to have education about the normal physiological changes during the pregnancy, because sometimes, for example, if she is getting cholasma gravidarum, in the physiological changes during pregnancy, I have told you that pregnancy mask or discoloration of the face will occur. Sometimes discoloration of the neck will occur, and over the abdomen we know that skin changes will occur, stria gravidarum will occur. So such changes, when it is getting, all of a sudden she may become totally upset. So it is, if she is having an awareness that all these things are due to the pregnancy, once after the delivery all these things will decrease or it will subside, she will be psychologically, she will be in a comfortable zone. So for that also this antenatal care helps. Another one, in order to discuss the couple about the place, time and mode of delivery and the care of the newborn. Sometimes in India, especially in Kerala, we are not practicing it commonly, but in European countries, if you are going nowadays, home delivery is a very common. So they can decide whether they want to give birth at home or whether they want to give birth at a hospital. Even if they are selecting a hospital, so which hospital they want to have, what type of facilities they are expecting from the hospital, all those things they can decide in the antenatal period itself. And another one, about the time of delivery, when they want to deliver after 36 weeks, we know that the duration of pregnancy is 40 weeks, but after 36 weeks, at any time she can plan for the delivery and she can induce the delivery if she wants. So that also can be planned. And mode of delivery, sometimes she may need a cesarean, or sometimes she may need a delivery with the proper epidural analgesia for reducing the pain. So such things also we can discuss and we can finalize during the antenatal period itself. And another advantage or another aim is we can motivate the people for the family planning. During the antenatal period itself, we can discuss with them and we can go to a decision whether they need to have permanent methods or whether they need to have temporary methods of family planning. And another one is you can advise the mother about the breastfeeding, postnatal care and the immunization. Especially if it is a first pregnancy, she may not be knowing how to breastfeed her baby, how to hold the baby, what are the things she is supposed to do in the postnatal period, what about the immunization status, or what are the immunizations uh, she is supposed to give for her newborn baby. So all these things you can advise her during this antenatal care. And next is the objectives of antenatal care. It ensures a normal pregnancy with delivery of a healthy baby from a healthy mother. That in one word, it is the delivery of a healthy baby from a healthy mother. And the criteria for normal pregnancy is it should be a single baby in good condition, and delivery should occur at term without any maternal and fetal complications. Next, we can see about the antenatal visits. In the first visit, that is first time when she is coming to the hospital after confirming her pregnancy, what are the things we are supposed to do, that we are going to see here. The objectives of this first visit include, in order to assess the health status of the mother and the fetus, and to screen out the risk pregnancy and formulate the plan for subsequent management. Say first itself, when the mother is coming, you should assess whether she is having any risk or not. If such things are there, any risk factors are there, and if it is affecting mother or fetus, we should plan how to manage it and how to prevent the complication. That's the first objective. And second thing, obtain baseline information. All the basic information about the mother and her family history, everything should be collected in the first visit itself, and we can maintain a chart or booklet, something related to the, or even in your system itself, you can update the information related to that particular antenatal mother in the first visit itself. So when she is coming for the subsequent visits, on the basis of these reports, you can monitor the progress. During the first antenatal visits, we should take a detailed history of the mother, and we should do the examination of the mother, that is antenatal examination, and you should do the basic investigations. So now we are going to see this in detail. The history taking should include particulars of the patient, that is name, age, sex, education, occupation. That is baseline data you are supposed to collect from the patient, including her habits, her dietary habits, then her sleeping pattern, everything, bowel pattern, bladder pattern, all those history you are supposed to collect in this. And chief complaints and duration. In case if she is having any complaint, what are those complaints and for how many days or when it has started, that also you should be collected. And next is about the past history, that is whether the woman had any communicable diseases, whether she is having any sexually transmitted diseases, whether she is having any history of previous surgeries, especially related to the uterus, or any abdominal surgeries, history of any other complicated diseases. All these things should be taken, including her immunization history, and rubella vaccination history also should be taken. And next is about the obstetrical history. In the obstetrical history, you should ask about her previous history of previous childbirth, whether she got any abortion, what is the age of the, in case if she is coming with her second pregnancy, what is the age of the first child, what was the type of delivery, whether she got any complications during the first delivery. All this detailed history you are supposed to take. And next is menstrual history, that is duration of the menstrual cycle, whether she got a regular menstrual cycle or not, and whether she is having any other complaints related to the menstrual cycle. Those things should be collected. And next is family history. In the family history also, you should collect the history about the consanguineous marriage, and whether you should ask whether they are having any history, whether the partner is having any history of sexually transmitted diseases, whether they are having any history of hereditary diseases, genetic disorders, any chromosomal abnormalities in the family. So such histories you are supposed to take in detail. Next is personal history. In the personal history, you should ask about the habits, you should ask about the dietary pattern, sleeping pattern. Those things you are supposed to take in the personal history, hobbies, everything. Next is socio-economic history. By taking a view about the socio-economic history will help you to plan about her antenatal diet, about the mode of delivery, everything. Because for a average economic status house, if you are giving education about very costly food, it may not be possible for the family to afford that. So in that case, you should see the economic status, and on the basis of that economic status, you should give education about the mode of delivery, food items, everything. Next, particulars of the patient. That is, in the first history, we were supposed to take the particulars of the patient. That is, we should take the name, age, gravida and parity. Gravida is the number of pregnancy and parity is the number of deliveries. And it can be indicated by the obstetrical score. This GPLA, this is known as the obstetrical score. This G stands for gravida, that is number of pregnancy. P stands for parity. L stands for live births and A for the abortion. So in case if the mother is having a history of one abortion, and if the lady is pregnant and now if she came to the hospital with that pregnancy, means her obstetrical score, how it will be like this. That is, already she got an abortion, so G will be 1. G1 will be there. So G1, sorry, G gravida, parity, live births, abortion. So already she got an history of abortion. So A1 we have marked over here, and she is not having any children. This is her second pregnancy. First was abortion, so L0, and she didn't deliver any child. The first was abortion, so this is her second pregnancy. So history of delivery, parity is the number of delivery, that is also 0. And gravida, I told you that it is a number of pregnancy. Already first she had a pregnancy and that has got aborted. Now she is in her second pregnancy. So G2. This is a way of writing the obstetrical score. G2, P0, parity 0, L0 and A1. This is obstetrical score if it is a second pregnancy. Then address of the mother has to be taken, date of first examination has to be taken, and the chief complaints. In the history already I told you that the second thing should be about the chief complaints. In the chief complaints and about the duration, see, usually if for an antenatal mother, the chief complaints will be, see, if the pregnancy is not diagnosed, her chief complaint will be the amenorrhea. So you should ask the period of amenorrhea. That is, you should ask when was her last menstrual period. That is known as the LMP, last menstrual period, or LMP. And you should ask whether she is having any history of nausea, vomiting, vertigo. And you should ask whether she is having increased frequency of urination, constipation, heaviness of breast, whether she is having rise in temperature, edema. This edema also will be there in the pregnancy due to the hemodilution. That is, due to the, already I told you that in the normal physiological changes in the pregnancy, we have seen that pregnancy is a stage of hemodilution. That is, blood volume will be increasing, and when comparing with the increase in the volume, the blood cells is not increasing that much. So the number, that's why I told you that the woman will be, the hemoglobin level will be less if you are taking the HbA status. So because of this hemodilution, there will be a change in the osmoregulation. So there is a chance for extravasation of the fluid, and that may leads to the edema. That is, physiological edema will be there, and she may get pain in abdomen, she may have backache, and she may get vaginal bleeding. This vaginal bleeding, sometimes it may be a placental sign. We have seen what is placental sign in the diagnosis of pregnancy, and if it is placental sign, it is normal. And for some ladies, during the time of implantation means, already we have seen what is that. That is embedding of the ovum in the fertilized ovum in the uterus. So some ladies may get the implantation bleeding. See, during implantation, already we know that the type of implantation in the human being is interstitial implantation. That is, the fetus will be eroding the endometrium, and when it is eroding the endometrium, sometimes it may break the minute blood vessels and there is a chance of slight bleeding. So implantation bleeding may come, or placental sign may come, and you should see whether the bleeding is these two things. Otherwise, it may be a sign of abortion also. Next, past history. In the past history, already I had given an overview. You should ask the history of hypertension, diabetes mellitus, renal diseases, psychiatric diseases, ischemic heart disease, any other previous surgeries. These history you are supposed to take from the mother in the past history. Next, about the obstetrical history, you should ask about the duration of marriage, gravid, number of pregnancy, number of delivery, number of living children, health status of the babies, previous obstetrical history, that is antenatal and intranatal. That is whether she got any complications during the time of pregnancy in the previous previous pregnancy, whether she got any complications during the time of delivery, and even in the postnatal period also, after the delivery also, whether she got complications. That also should be collected. In the menstrual history, you should ask the age of menarche, that is when she got attained her first menstruation, and you should ask the normal menstrual cycle, what is the duration of her menstrual cycle, for how many days she is getting the menstrual bleeding, and you should ask about the last menstrual period, the first day of last menstrual period, that you should collect. And by using this first day of last menstrual period, you can calculate the expected date of delivery. For calculating the expected date of delivery, we are using the Nagel's formula. And how to calculate it means LMP plus 9 months plus 7 days will give you the expected date of delivery. For example, if the LMP of the mother is September, assume that her LMP last menstrual period was on September 1st. So September 1st plus along with that you should add 9 months. So October, November, December, January, Feb, March, April, May, June. June 1st she will be completing 9 months. And along with the June 1st you should add this 7 days also. So June 1st plus 7, June 8th. So in that case her expected date of delivery will be June 8th. By using this simple formula, even if you are not a medical person also, you can calculate the expected date of delivery. And one more method is there, that is also Nagel's formula only. That is, you can reduce 3 months from this LMP. That is, in the same example, you just LMP was September 1st, I told you. Reduce 3 months. So if you are counting backward, August 1st, July 1st, June 1st, and plus 7 days. June 1st plus 7 days, June 8th. In both ways, you will be getting the same thing only. That is, two methods are there, either LMP plus 9 months plus 7 days or LMP minus 3 months plus 7 days. And about the fast family history of hypertension, diabetes mellitus, and multiple pregnancy, that also should be collected. And if she is having the family history of diabetes mellitus or hypertension, she may get the same problem during her pregnancy. And if she is having a history of multiple pregnancy in the family, if there is a family history of multiple pregnancy, sometimes there is a chance for getting multiple pregnancy for this lady also. So you should do the proper investigations and you should make sure whether it is a twin pregnancy or not. Next is personal history. You should ask about the contraception, whether they were using any contraceptives before the pregnancy, whether she is having the history of smoking or having the history of alcoholism. And if she is having this history, we know that if she is having the history of smoking, that may leads to the intrauterine growth retardation, and there is a chance for alcoholism. There is a chance for abortion also. And if she is using alcohol also, sometimes there is a chance for accidents and another reason, and that may complicate the baby. And another one, there is a chance for growth retardation of the baby. And socioeconomic history, you should ask about the occupation and family income. We should give importance to the occupation of the mother and for the father. Mainly, you should see whether they are having any exposure to the occupational hazards. That is, whether they are living in an area where they are getting exposure to the X-rays or lead or some other chemicals that are having the capacity to produce defects on the baby. So that history should be taken in detail. And drug history, you should ask to the mother whether she is using any antihypertensives, hypoglycemics, antidepressants, corticosteroids, or anticoagulants. If she is taking that, you should take these cases as risk cases and you should monitor and you should give special care to these groups. Next is physical examination. This includes general physical examination and abdominal examination. That is, normal head to foot examination is general physical examination and abdominal examination also. In the general examination, you should see the appearance of the mother, vital signs you have to take. You should take the height and weight of the mother. If the shoe size is less than 5 and if her size is less than 5 feet, there is a chance for, that is short structure is there, so her size of the pelvis also will be less. So in that case, there is a chance for cesarean. And if she is having overweight, sometimes the baby also may get large size, so there is a chance for complication. And you should ask about, you should see whether she is having, whether she is anemic, whether she is having jaundice, edema, and you should see the neck. Already I told you that during the pregnancy, in the normal physiological changes, we have seen that the thyroid gland size will be increasing and the thyroid hormone production also will increase, and it helps for maintaining the normal metabolism that we have seen. So you should palpate that and you should feel for the enlargement of the thyroid gland, and if she is having that complaint, enlargement of thyroid gland, you should educate her it is normal for the pregnancy. And you should see the tongue and teeth and gums. Already I told you that softening of the gums will be there, so you should ask whether, you should see whether she is having gum bleeding, tooth decay, whether she is having glossitis. Those things you should see. And you should see her breast. In the breast you should see for the inspection, in the inspection of the breast you should see for the size of the breast, and you should see for the bluish surface veins, you should see the primary areola, secondary areola, Montgomery tubercles, and you should see the condition of the nipples, whether it is retracted, whether any cracks or ulceration is there over the nipples. You should see these things over the in the inspection. And next is the palpation of the breast. You just palpate both breast and you should see whether she is having any tenderness, any mass, whether she is having swelling or pain. And in the later weeks of pregnancy, you can express the colostrum and you can make sure that adequate colostrum secretion is there. And after that, you should go for the abdominal examination that I will take separately. Next is the investigations. You should take the complete blood count, blood grouping and RH typing, urine routine examination, RBS, VDRL, test for the venereal diseases, HBsAg. You should see whether she is having hepatitis B, and maternal serum alpha protein level should be taken, and if it is abnormal, it suggests the chromosomal abnormalities of the baby, so that should be taken. And you should do the serological test for rubella and hepatitis, and you should go for the ultrasonography in order to make sure the proper growth and development of the baby. And schedule for the subsequent visits. In India, we are telling that the antenatal mother should visit the hospital at an interval of 4 weeks up to 28th week, that is up to 7 months. Every month she should come to the hospital, and after that up to 36 weeks, every 2 weeks she should come to the hospital, that is twice in a month. And later every week, 36 to 40 weeks or till the time of delivery, every week she is supposed to come to the hospital. So this is the schedule of antenatal visit. In the first visit itself, you should educate the mother about this schedule. And if you are looking into the WHO recommendation about the antenatal visits, they are telling that there should be one visit in the first within 16 weeks of pregnancy, and second visit can be between 24 to 28, third visit at 32 weeks, and fourth visit at 36 weeks. So WHO is recommending only 4 antenatal visits. And the objectives of the subsequent visits include, in the subsequent visits, you should see the fetal well-being. You should assess the lie, presentation and position of the baby. Lie is the relationship of the long axis of the baby to the long axis of the mother. That is, if the baby is, sometimes if the baby is lying, baby's spine and maternal spine is in the same axis, that is lie is longitudinal. So if the baby's spine is transverse and the maternal transverse to maternal spine, the lie is transverse. So that you should see. Next is the presentation. Presentation means it's the part of the fetus which is coming in the lower pole of the uterus. That is, in the lower part of the uterus, which part of the baby is there, that you should see. But it's presentations. In majority of the cases, if it is normal, cephalic presentation or head will be in the lower part of the uterus. And next you should see the position of the baby, whether the baby is in anterior position or lateral position. So the different position examples I will teach you later. That is, anyway, you should see the lie, presentation and position of the baby, how the baby is lying. And you should assess for the anemia, pre-eclampsia, amniotic fluid volume and fetal growth. Anemia means we know that it is reduced hemoglobin level. Pre-eclampsia means it is hypertension during pregnancy, and it is associated with edema and proteinuria. If the mother is having high blood pressure, and along with that if she is having edema and proteinuria, that condition we are calling as pre-eclampsia. And you should assess the amniotic fluid volume also. If it is excess, it is polyhydramnia. If it is less, it is oligohydramnia. That you should see, and you should assess the fetal growth. And you should organize specialist antenatal clinics with cardiac and diabetes, cardiac diseases and diabetes. If the mother is having such problem, you should give special care to those people. And select a time for ultrasound for amniocentesis, chorionic villus sampling if it is needed. Ultrasonography usually we are doing at 6th week in order to identify the problems, whether the baby is having any problem, whether the growth is normal. For such things we are doing the ultrasonography normally nowadays. But amniocentesis and chorionic villus sampling, amniocentesis is the that amniocentesis means we are taking the aspirating the amniotic fluid and we are doing the analysis of the amniotic fluid. And chorionic villus sampling means chorionic villi, already I have told you that it is there in the placenta. So that chorionic villi you should take, aspirate, and we will send it for the analysis. So these two things we'll be doing if you are suspecting any abnormalities. And in the subsequent visit also you should do the general examination, that is you should take the vital signs, you should assess the weight, especially the weight of the mother is significant, it shows the proper growth of the baby, and already the weight changes during pregnancy we have seen in the physiological changes during pregnancy, go through that. And vital signs, you should see whether the lady is having anemia, edema, and whether they are having any other complaints. And you should ask to the mother whether she is feeling, whether she is able to identify the fetal movements, and you should ask the date of quickening. Quickening also I told you, it is the first fetal movement felt by the mother. You should see this. And gestational age also should be calculated. That gestational age you can calculate by using the Nigel's formula. How many weeks she has crossed, that you can identify by that. And health education should be given during this period about the diet, exercise, all those things you can give here regarding the family planning, mode of delivery, signs of onset of labor. All this health education you can give in the subsequent visits. And you should treat anemia, and if she is not anemic you should take measures to prevent the anemia. So you can give iron tablets, otherwise you can educate her to take iron rich foods. And developing individualized birth plan, what type of delivery she needs, where she wants to deliver, whether she wants birth companion, whether she wants her husband to be inside the labor room. All these things can be planned in the subsequent visits. And next is about the abdominal examination. In the abdominal examination we are doing inspection, palpation, percussion and auscultation. In the inspection you should see the size of the uterus. Size of the uterus you should see, and that is you should see whether it is appropriate to the gestational age or not. And next is shape of the uterus. If the lie is longitudinal, the shape will be almost like this, that is this is longitudinally ovoid. And if it is transverse, the shape will be like this, transversely ovoid. So you should see the shape of the uterus. And next is counter. You should see whether it is convex or concave. Sometimes dimpling will be there, that is there or not. But usually if the proper position and growth is there, means it will be convex, the counter will be convex. And you should see the condition of the bladder, whether the bladder is emptied. Otherwise if it is not emptied, you can feel it, you can see it over in the suprapubic region. And you should see the condition of the umbilicus, whether the umbilicus is protruded or dimpled, that you should see. And next you should go for the fetal movements, whether the fetal movements are visible or not. And if it is not visible, you should ask to the mother whether she is able to identify it or not. Next you should see the flank region towards the end of the pregnancy, and flank region you should see whether it is full or not, or full or empty. And next is skin changes. In the skin changes you should see the linea nigra. Here you can see this pigmented line that is extending from the xiphoid process of the sternum to the symphysis pubis, linea nigra, and you should see the stretch marks, that is stria gravidarum. Here you can see the strias. See, these stretch marks are there that you should see, and you should see whether she is having any scar mark of previous cesarean or previous surgery. That also you should see in the inspection. And in the palpation, first you should take the fundal height, that is palpate the tip of the fundus parabdominally and measure from the upper border of the symphysis pubis to the fundus. That is the fundal height. Then you should see the lie of the baby, whether it is longitudinal or transverse or oblique, that you should see. Then you should take the abdominal girth. At the level of the umbilicus, you should take the width of the girth of the abdomen. So it gives you a picture about the polyhydramnias, oligohydramnias, and even about the growth of the baby also. Usually it will be at term, it will be within 100, and if it is more than 100, if the abdominal girth is more than 100, you can suspect either polyhydramnias or twin pregnancy. Next, in the palpation, first you should do the fundal palpation. You should palpate the fundus of the uterus. Here you can see both hands are palpating the fundus. Then you should go for the lateral palpation, that is known as lateral grip, frontal grip, lateral grip. Then you should come for the second pelvic grip. See, here they are holding the presenting part by using the thumb and index finger, and the examiner will just move and see whether the pelvic presenting part is moving or not. That is whether it is ballotable or not. And this is known as second pelvic grip or Pavlik grip or Pavlik maneuver. Next is first pelvic grip, that is pelvic palpation. That is by using both hands we will palpate this pelvic region. So all these four maneuvers together is known as Leopard's maneuver. So this is Leopard's maneuver 1, 2, 3 and 4. So this demonstration I will do in another video. Next is after the palpation you should go for the auscultation. For auscultation you can use either the Pinard stethoscope or Doppler or fetoscope also we can use. And you should identify the location of the fetal heart sound. And if the fetal heart rate is between 120 to 100 beats per minute, it is normal. If it is above 160 beats per minute, it shows a tachycardia, fetal tachycardia. And if it is less than 120 beats per minute, it indicates fetal bradycardia. Next, we can see the antenatal advices. What are the advices or what are the topics you should include in the health education? First, let us see the principles of antenatal advice. It is to impress the patient about the importance of regular checkup and to maintain or improve the health status of the woman to the optimum till the delivery by judicious advice regarding diet, drug and hygiene, and to improve the tone up the psychology and to remove the fear of pregnancy by taking sympathetically to the patient and explaining the principal changes and events likely to occur during the pregnancy. The antenatal advices topics include diet, rest and sleep, bowel pattern, personal cleanliness, clothing, shoes and belt, dental care, care of the breast, coitus, traveling, smoking and alcohol, immunization and drug. And in the diet, you should tell her to take nutritious, balanced and light food. If she is taking a heavy food, sometimes she may get the discomfort. So tell her to take the light and easily digestible food. And the food should be rich in protein, vitamin and minerals. And it should be with according to her choice. And it is better to give small frequent feeds for the antenatal mothers. It helps for the digestion and it helps for avoiding discomfort for the mother. And the daily dietary allowances for the mother includes, in the second half of pregnancy, we should give 2000 kilocalories per day, and additionally you are supposed to give 60 grams of protein, 40 milligrams of iron, 400 micrograms of folic acid, 1000 milligrams of calcium and 6000 international units of vitamin A should be added to the diet along with the normal diet during from the second half of pregnancy onwards. And about the rest and sleep, 8 hours rest is needed for the woman, and you can advise her to take 2 hours sleep or rest in the after the midday meal, and she is supposed to avoid sternus or heavy work in the first trimester and the last trimester. If she is going for such works in the first trimester, there is a chance for abortion, and if she is doing it in the last 4 weeks, there is a chance for preterm onset of labor or premature onset of labor, and it may end with the preterm delivery. Next, about the bowel pattern, there is a chance for constipation, and this constipation is due to the effect of progesterone that we have seen in the normal physiological changes. So for avoiding that, you should advise her to take plenty of fluid, you should advise her to take vegetables and milk, and you should regulate the diet by including high fiber containing diet. And next, about the intercourse, she should be avoided it in the first trimester and in the last 6 weeks. If they are not avoiding it in the first trimester, there is a chance for abortion, and the last 6 weeks there is a chance for preterm onset of labor or premature labor or preterm delivery. Next, about the bathing, she should take bath daily, and she should maintain the cleanliness of the body. That helps her to prevent the infection. Next, clothing, shoes and belt. Tell her to wear loose and comfortable garments, and high heel shoes should be avoided because there is a chance for balance problem, and she should not use the tight belt or other tight clothings. And about the dental care, already I told you that there's a chance for gum bleeding and other problems, so she should maintain the hygiene of the mouth. And in case if she is having dental caries or if she is having decay, the best time to consult the dentist is second trimester, because in the first trimester she will be having severe nausea and vomiting, and towards the third trimester, when all the pregnancy changes are worsening, it will be difficult for the mother. So in case if she needs a care, the second trimester is the ideal time for that. And next is care of the breast. During the antenatal examination, already I told you what are the things you are supposed to see in the breast. And if the nipples are anatomically normal, if it is not retracted, you can advise her to maintain the normal cleanliness, that is enough. But if the nipples are retracted, it will be difficult for the mother to feed the baby in the postnatal period. So in that case, that is if the mother is having a retracted nipple, you should tell her to pull it out manually. Next, about the traveling. Traveling should be avoided in the first trimester and the last 6 weeks. Even if they are traveling also, they should avoid two-wheelers and three-wheelers especially. And the air traveling is contraindicated in the case of placenta previa, in the case of preeclampsia, and in the case of severe anemia also. Next, about the smoking and alcoholism. Smoking and alcoholism both should be avoided during the pregnancy, and if the mother is having the history of smoking, there is a chance for low birth weight babies, and there is a chance for abortion also. And if she is having the history of alcoholism, that may lead to the fetal growth retardation. The size of the baby will be less. Next, about the immunization. TT2 doses we are supposed to take during the pregnancy if it is not taken in the already, and hepatitis A vaccine, hepatitis B vaccine and rabies vaccine. These 4 vaccines we can give if needed. TT should be given compulsorily. Other things, if it is needed, we can give. That is if the mother is already not vaccinated. And these vaccines are contraindicated. That is, all the live vaccines are contraindicated during pregnancy, because this live organism, live means we are giving the mild amount of organisms only. So these viruses especially may pass through the placenta and baby may get the infection. So avoid the vaccines of rubella, measles, mumps, varicella, all those things during the pregnancy. All those things are live vaccines. Next, about the drugs. Almost all the drugs will pass through the placenta and the baby also will get the drugs. So when you are taking the drugs, always it should be taken with the prescription of a doctor, or it should be done with the advice of a doctor. You should avoid the self-medications. So that's all about the antenatal care. Thank you for watching this video. We will meet soon with a new video about the pregnancy and the management of pregnancy. Bye till that.